Hi, I'm Mia, and I will be doing your physical examination today. So first I'm going to go ahead and provide privacy. And I'm going to go do hand hygiene. Hand hygiene, right off. Okay. So would you mind telling me what your name and date of birth is?
Micaiah Jackson, 10/7/04.
Okay, it matches with her wristband. I just want to let you know everything that we do in this physical examination today is confidential, and you have a right to defer anything that we do today.
Okay.
Okay. Can you tell me where we are today?
The Sim Lab in Martin Hall.
Nice. And what year is it?
2025.
Okay, awesome. And do you know who the president is?
Donald Trump.
Okay, awesome. Would you mind just give me a wave? Okay, patience follows verbal commands. Her speech is appropriate for age, and she is AAO times 3. Okay, so I'm going to go ahead and start with, I'm going to go ahead and assess your head. Scalp is clear, no lumps or lesions, head looks good. Okay, and now I'm going to go ahead and assess your eyes. So I'm going to dim the lights, and I'm going to assess your pupils first before. Okay, they're about a 4, and I'm going to dim the lights, and I'm going to shine this light in your eyes, and it's going to be a little bright for a second. Is that okay?
Okay.
Okay. Okay. Okay. Pupils constricted bilaterally, and they hit about a 3 as I shine the light in them bilaterally. And now would you mind following my pen for me? Okay, patient's eyes accommodated. So patient's eyes were perla. Their pupils were equal, round, responsive to light, and they constricted bilaterally and accommodated. Okay, so now I'm just going to inspect them also. There's no discharge, no redness, and that's all. And so now I'm going to go ahead and move to your ears. Ears are aligned with the outer canthus of the eye. Both sides, they are symmetrical. And I'm going to inspect the external ear characteristics. No redness, no bruising, no lumps or lesions or bumps. No drainage on the inside of the ear or the outsides. And there's no lumps or lesions or bruises, symmetrical with the outer canthus of the eye, and no drainage bilaterally for either ear. So now I'm going to assess patient's nose, and it's symmetrical, no lumps or lesions. And I'm going to, if you tilt your head up, I'm going to check the insides. Yep, they're present, and hair is evenly distributed, and it is pink and moist inside of the nose. Okay, now I'm going to assess your mouth. Would you say cheese for me? Okay, no caries on the teeth. Teeth are clean, no missing teeth. Can you do this so I can see your upper gums? Upper gum is pink and moist. And now can you do the bottom? Bottom gums are pink and moist, no ulcerations, no lumps, lesions on the top or bottom gums. Now could you open your mouth for me? Okay, buccal mucosa is pink and moist. And then we look at the top. Roof of mouth is also pink and moist, no lumps or lesions. And now look at your bottom. Could you put the tongue on the roof of your mouth? Awesome, no lumps or lesions, sublingually, and no bruising, and it's pink and moist. Now could you stick your tongue out for me? Tongue is symmetrical, pink and moist, and in the middle of her mouth. And now can you say ah? Okay, tonsils are present, and they're a 1+ grade, pink and moist, and it rises upon phonation. Okay, now I'm going to assess my patient's neck. Neck is symmetrical on both sides. There's no pulsations present. Pulsations. I'm going to go ahead and assess my patient's carotid pulse. Pulse is a 2+. So patient's pulse is a 2+ bilaterally. And I'm gonna go ahead and assess for carotid bruits. So whenever I put my stethoscope on your hand, would you hold your breath for me?
Mm-hmm.
And I'm using the bell of my stethoscope. Okay, hold your breath. No bruit present. Hold your breath. No bruit present bilaterally for the carotid. Now we'll go ahead and check your vision out here. So if you could just follow me outside. Okay. And I'm observing my patient's gait, and her hips are in line with her shoulders, and she's walking unlabored and even. Can you just stand on this line right here for me? So whenever I tell you, I'll have you close one eye, then close the other eye, and then close both eyes, and I'll point to a line, and if you'll just read it to the best of your ability. So will you go ahead and leave both eyes uncovered, and we'll start at this line right here.
PTOCET, ZLPEDTC, ETODCFO, DPCZLFT, CFDTEOP, LDCZOTE, PFODTEL.
Okay, patient has 20/16 vision with both eyes. And now could you cover your left eye for me?
PTOCET, ZLPEDTC, ETODCFO, DFCZLFT, CFDTEOP, LDCZOTE, PFODTEL.
Patient's right eye is also 20/16. And then can you uncover and cover your other eye? Thank you.
PTOCET, ZLPEDTC, ETODCFO, DPCZLFT, CFDTEOP, LDCZOTE, PFODTEL.
Okay, patient has 20/16 vision and right eye, left eye, and both eyes together. Okay, you can follow me back into the room. And I'm gonna go ahead and note the visual acuity. Okay, and I'm just gonna assess your neck one more time to make sure I have everything. There's no pulsations. It's symmetrical and it's aligned with the middle, and your trachea is in the midline of your neck. Okay, now I'm gonna go ahead and assess your posterior chest. So I'm gonna step around back here. Is it okay if I uncover your back for a second?
That's fine.
Thank you. Unsnap your gown. Okay, so I'm just assessing. Skin is appropriate for ethnicity. No bumps, no lesions, no abnormal moles or anything of the sorts. The rise and fall of the chest is symmetrical, and breathing is unlabored. Okay, so now I'm just gonna push a little bit on your back. It shouldn't feel tender, but let me know if it does. Any tenderness?
Mm-mm.
Okay, now I'm going to go ahead and assess my patient for CVA tenderness. Let me know if this is tender at all. Is that tender?
Mm-mm.
Is that tender?
Mm-mm.
Okay. Patient does not have any CVA tenderness. I'm going to go ahead and snap your gown back up. I'm going to go down to the anterior. And so now I'm going to assess my patient's respiration rate, if you'll just breathe regularly. Okay, patient's respiratory rate is a 20. I'm just going to make note of that. Okay, and now I'm going to listen to your breath size from the anterior, and then I'll move around to the posterior if that's okay.
Mhm.
Okay.
Okay. Close your, cover your left eye.
If you'll just take a deep breath every time I place my stethoscope.
Okay, left eye 2020. Keep your right eye. Right eye 2020. Okay, 2020 bilateral. Now did you read the small thing to both eyes? Okay, 2020 vision. And gait was normal.
Okay, patient's breath signs are clear bilaterally, hearing no crackles or wheezing, and so now I'm going to check the posterior breath sounds. I'm going to uncover your gown really quick first. I forgot to assess under her gown for that part. So I'm going to uncover your gown if that's okay. And if you'll just take a breath every time I do on the back too as well. Okay, 2 more big deep breaths. Okay, patient's breath sounds are clear from the back as well. And I'm going to go ahead and give the patient privacy one more time. Okay. And so now I'm going to listen to your heart sounds, if that's okay. And I'm going to just listen, so you can just sit there, and I'm going to move your gown down so that I can get under skin, if that's okay.
Okay.
So I'm going to start with my diaphragm, and then I'm going to switch to my bell. So I'm starting at the aortic. S1 and S2 are present, no extra sounds or murmurs or gallops. Now I'm going to go to your pulmonic. S1 and S2 present, no gallops or murmurs. Now I'm at her herbs point. S1 and S2 present, no gallops or murmurs. Now I'm at my patient's tricuspid. S1 and S2 are present, no gallops or murmurs. And now I'm going to go to my patient's mitral. S1 and S2 are present, no gallops and murmurs. So all heart sounds were clear. S1, S2 was present. There were no murmurs or no gallops. So now I'm going to go back up with the bell of my stethoscope and do the same thing starting from the mitral. Okay. At her tricuspid. At her herbs. Her pulmonic. And her aortic. So there are no low or high pitched sounds with the bell of my stethoscope. I didn't hear any murmurs or S3s or S4s. Okay, now I'm gonna go ahead, I'm gonna get your gown straight, and I'm gonna go ahead and count for your apical pulse. Okay, patient's apical pulse was a 65. And I'm gonna go ahead and listen to, just to make sure that they are equal. If it's okay with you, I'm gonna put my stethoscope under your chest one more time. Okay, with auscultation, patient's apical pulse was a 65 as well, so they were equal, so that's good. And so now I'm going to count my patient's respiratory rate. I already did that. Okay, so I also realized I forgot to assess for turbinates under her nose, so I'm going to do that really quick. Add it until your head up. Turbinates are present and symmetrical, and septum is midline. Okay, now I'm going to assess your upper extremities. So I'm just going to look at them. Okay, no lumps or lesions. No lumps or lesions in arms or shoulders. No bruises or bumps. And now I'm going to check your capillary refill in your fingers. Okay, capillary refill is less than 10 or 2 seconds in all 10 fingers. And so now I'm going to check your radial pulse. Pulse is equal bilaterally and it's a 2+. And now I'm going to check your brachial pulse. Pulse is present and equal bilaterally and it's a 2+ grade. Okay, now I'm going to check your strength in your arms and your shoulders and your fingers. So can you put your hands out like this for me? And I'm going to squeeze them if you'll just spread your fingers out for me. Okay, I'm going to put your thumb in there. One more time. Awesome. Fingers are a 5 out of 5 strength. And now can you stick your arms out like this? And can you raise your wrist up? Raise your wrist down? And can you wiggle your fingers? So range of motion in wrist and fingers was a 5 out of 5, full range of motion. And now can you do this for me? And can you push against me? Awesome. And can you push against me? Awesome. And now can you raise your arms out? And can you push against me? And can you push against me? Great. Okay, arm strength is a 5 out of 5 as well. And can you do this really quick? Okay, full elbow range of motion. And I'm gonna press against your shoulders. Can you push up? Awesome. Shoulder strength is a 5 out of 5 as well. Can you raise your arms all the way up, all the way down, all the way to the side, all the way down, and all the way to the back? Full shoulder range of motion, full elbow range of motion. Can you do your wrists like this? Can you roll them? Full wrist range of motion, and we already checked that finger range of motion. So full range of motion in all upper extremities. Now I'm gonna have you lay down and I'm gonna assess your abdominals. That's okay. And I'm gonna have to expose my patient's abdominals, so I'm just gonna go ahead and give privacy. And is it okay if I raise your gown up?
That's fine.
Okay. Okay, so first I'm just going to inspect my patient's abdominal region. Scan is appropriate for ethnicity. No lumps or lesions, no pulsations. And stomach is symmetrical. Her umbilicus is midline. And now I'm gonna assess my patient's contour. Stomach is flat. and no lumps, lesions, or anything. So now I'm going to go ahead and listen to your stomach. So it might, so it's gonna be cold, but I'm just gonna listen. Let me know if any point if it hurts or anything. And I'm gonna start at the right lower quadrant and go clockwise. Okay, patient's bowel and abdominal sounds were normal active in all 4 quadrants. Okay, now I'm gonna go ahead and palpate your abdominal section. If you feel at any point any tenderness or uncomfortable, you can tell me to stop. And I'm gonna start with light palpation, circular motion from the right lower quadrant and go in a circle. Okay, no lumps or lesions or anything was found in all 4 quadrants. They were all clear. And now I'm going to do deep palpation, and so you'll feel more pressure, but let me know if there's any pain. Okay, no tenderness in any quadrant, and no organs other than the liver were palpable, so that's good. Now I'm gonna have you stay laid down, and I'm just gonna assess your lower extremities, if that's okay. I'm gonna keep you covered. Okay, so I'm assessing my patient's legs right now, and skin is appropriate for ethnicity, bilaterally. No lumps or lesions, moles, or bruising. Skin is warm and dry. Now I'm going to assess my patient's feet. And I'm going to make sure I'm getting the soles of the feet bilaterally. Okay, patient's feet, I'm going to check in between the toes. Okay, patient's feet are dry, no moisture, no cracking, scaling, no lumps, no lesions, no bumps. Bilaterally, they're both clear. And so now I'm going to go ahead and check the capillary refill and my patient's toes. Okay, capillary refill is less than 10 seconds in all 10 of the toes. And I'm going to go ahead and grade my patient for edema. Okay, no edema present. It's a 0+, bilaterally on both legs. Now, and there's no presence of varicose veins on her legs. Okay, now I'm going to go ahead and check my patient for leg strength. If you'll go ahead and raise this leg up, and can you push up on my hand? And now can you push down on my hand? Okay. Patient's leg is a 5 out of 5 strength. Can you push up? And can you push down? Okay, patient's leg is a 5 out of 5 strength bilaterally. And now I'm gonna check her feet for strength. Can you push up? Okay, can you push down? Okay, patient's toes are a 5 out of 5 strength. Can you wiggle your toes for me? Okay, full range of motion in the toes. Can I lift your feet up? And can you roll your ankles down? And then up? And then in a circle? Okay, ankle range of motion is full. I'm gonna lift your leg up. Can you bend your knee for me? And straighten it? Okay, and I'm gonna lift your leg up. Can you bend it? And straighten it? Knee range of motion is full. Okay, and I'm gonna go ahead and check my patient's femoral pulse. Would you like me to check it?
No, thank you.
Okay, and so what I would do if I were checking femoral pulse, I would take my 2 fingers and I would place it in her femoral pulse, and I would do it bilaterally at the same time and make sure it's present and equal. Also just realized I forgot to check my patient's gag reflex. Will you set it for me really quick? Thank you. Would you like me to check your gag reflex?
No, thank you.
Okay, if I were to check my patient's gag reflex, I would take my tongue depressor and I would stick it in the back of her throat, and if she elicits a gag, the reflex is positive and that is normal. Okay, I'm gonna go ahead and have you swing your legs around the bed for me. Okay, and I'm just gonna check range of motion one more time. Can you lift your legs up? And lift your legs down. Okay, full range of motion in the knees. And would you stand up for me really quick? Okay, can you lift your leg up like this? And now can you lift it, put down? And then do your other leg. And down. And can you do it out to the side? Yep. And then can you do it out the side on the other leg? And put it down. Okay, patient has full range of motion in the hips as well. And now if you could lean over to the side and bend at the hips. Okay, and now up, and now to the other side. Awesome. And if you could bend forward for me, and then bend backwards. Patient has full range of motion in the spine as well. And now could you bend forward for me one last time? I'm gonna check my patient's spine. Patient, you can stand back up for me. Patient is negative for her scoliosis screen. And if you could walk to the door for me. And then you can turn around and walk back. Patient's gait is straight and equal. And she is negative for scoliosis screen. And if you could sit back down for me. Thank you. So now our physical examination is complete. I'm going to go ahead and perform hand hygiene. And I'm going to place the call light in reach. Thank you so much for letting me do your physical examination today.
You're welcome, thank you.
And I'm going to leave and provide privacy.